Cláudia Ortet. I am a PhD student and one of the authors of this article. And as the title implies, our team conducted an interview study in Portugal during the worst time of the pandemic to understand how Portuguese institutions and municipalities ensure the socialization and connectedness with senior citizens. This is the team that authored the paper, and unfortunately, Francisco and Sónia are not here, but Liliana and Anna are, so you can meet three faces. And this team not only interviewed the institutions and municipalities, but also made the interview protocol, contact the institutions, and collect and analyze all the data. To give a little context to the study of this article, the ugly truth is that billions of people's lives have been drastically changed by the global COVID-19 pandemic. And as a result of it becoming a global public health concern, it has disrupted family plans, changed routines, and also reduced employment opportunities. So as a result, it has contributed to the rapidly expanding demands on the already overburdened healthcare system. Additionally, the cessation of labor activities has societal, economic, and psychological effects. And moreover, the COVID-19 mortality rate has increased to over than 20% in aged population, with seniors reporting the highest rates of death, particularly those with underlying and chronic medical issues. Aging is also frequently portrayed as vulnerability, decline, and morbidity, and these ageist behaviors in society have impacted the healthcare system's clinical decision-making and also the moment to apply medical treatment, which sometimes results in santicide, that is the killing or abandoning of elderly populations that may lead to death. Also, governments developed a number of policies aimed at preventing the coronavirus from spreading by separating people physically and socially. And this drastic change in how senior citizens live has created also a number of difficulties for their health and wellness, contributing to sedentarism, as well as feeling of isolation and depression. Face-to-face interactions and face-to-face activities started to be conducted virtually through devices and video conferencing in order to get around some of the problems. And this allowed for ongoing communication and active involvement despite the physical distance between people. So the majority of government policies were cited as being important in limiting the virus transmission, while the virtual component ensured the continuous communication and information exchange. These, however, are greatly impacted by behavioral and communication patterns. For instance, those who were already isolated before the pandemics may not accept the technology to start communicating in the pandemic. And also the mental health and welfare of seniors may fail to accept and adjust to new circumstances that we lived during the outbreak. Specifically in the light of the COVID-19 pandemic, there are a number of obstacles to be effective while applying ICT as a form of social and psychological intervention, especially among senior communities, such as the requirement of third-party involvement, the limited knowledge and skills of seniors with technology, restricted access to the necessary tools for communication and information, and also their attitudes against those technologies. Therefore, in order to overcome some of the barriers, it is crucial to evaluate their preferences and barriers to technology use, taking into account the pre-pandemic digital literacy and also the preference of digital platforms for communication. It is also important to respect the privacy of elderly populations. We can, for instance, obtain informed consent. We need also to raise awareness of available services like apps, digital platforms, and also learning programs. And most importantly, to make regular use of the technology to assure that it is used continuously. Portuguese representatives from senior institutions and municipalities that create programs for the elderly participated in semi-structured interviews. A total of 334 public contacts received our email inviting them to take part in the in-person or online interview because we had a pandemic, so much of the interviews had to be conducted online. And 72 entities were interviewed, where 51 were senior institutes and 21 were municipalities. One of the main drivers of older citizens' participation in learning communities were the institution's dedication to offering learning and social environments. Some created a variety of social, cultural, scientific, technological, recreational, and even sporting activities with the support of the municipalities, because some of the municipalities paid to the institutions to continue the activities to ensure socialization, active and healthy aging, and the promotion of physical and mental health. So throughout the conducted interviews, the main pandemic constraints reported by senior institutes and municipalities were the global shutdown, being highly affected by the imposed closure of facilities in terms of income, as the economy sector was also severely impacted. Geographical location, since in especially remote areas, aid to assist senior citizens was difficult to obtain or deliver. The social isolation and feelings of depression, and also technological issues, as most of the institutions were not prepared in terms of equipment and formation to adapt to the exacerbation of ICT in the pandemic. Moreover, the main barriers perceived by the participants in implementing ICT measures were the info exclusion of senior citizens, resulting not only in dropouts and lack of engagement in adhering to ICT use, but also to social exclusion, as they deprive themselves for the available means of communication. Moreover, one of the most mentioned barriers was also the lack of resources, both human resources to reach to everyone, but also in terms of equipment and internet provision. It was also noticeable some technological aversion of senior citizens before the pandemic. However, the difficulties in implementing some of the ICT practices in some cases also led to this senior citizens' aversion to the technology. On a brighter side, it was also noticeable that either institutions or municipalities were deeply committed to the cause and maintained in different formats some of the informatics, the physical education and art classes, and also social, cultural, and educational activities such as lectures, poetry reading, cooking. And this commitment also raised awareness and enabled the creation of voluntary projects to promote social interaction. As such, the main solutions were based on social connection, and to do so, equipment such as smartphones, computers, and other devices were delivered by some institutions and municipalities to senior citizens to enable the virtual communication between them and the organization, but also to teach them how to use it with their family and friends, to order food, and also to keep themselves entertained. So the results of our study showed that these institutions were vital in creating classes and activities to keep seniors engaged, which had favorable effects on cognition, mental health, and decreased the risk of social isolation. It was encouraged to use online communities, such as Facebook, as well as phone communication, WhatsApp or Zoom, to stay in touch and help with everyday tasks. In fact, the telephone contact, which requires less technological infrastructure, and it is frequently suggested as a potential option to overcome the pandemic restrictions, has been heavily relied upon by these institutions, being the ultimate device that can almost everyone owns and that allows the use of the cited platforms.
You were talking about devices, you were talking about platform, but what is the accessibility to the internet? Is internet for free? Because you also need routers and you have to buy. So had you any questions related to this internet accessibility?
Yes, we also posed those questions, and we found that in specifically remote areas, some senior citizens didn't have access to the internet, but nowadays most of people have internet because the packaging of TV, internet, and phone is all connected. So the internet was not the biggest problem, but the owning of the devices, the eagerness to learn to use the technology, that was the biggest problem.
Thank you. It is really important to understand that there is a learning we have to do before we can start using technology, and it's not related to age, and especially if you are in social environments. My mother just a few months ago wrote on Facebook that your profile photo is ugly. I phoned her that I'm so sorry, but my colleagues are reading, my students are reading, can you please remove this comment? So yeah, it's actually a true story. So basically the educating people, it's extremely important because they don't understand the whole context. And
yeah,
thank you.
and also the privacy issues. Yeah.